Hi, everyone. This is Sonia from Mettle Health, and today we are so excited to have two of the wonderful clinicians on the Mettle Health counselor team, Heather Isaacs and Chris Adrian, who are going to be having a bit of a conversation around their roles as chaplain and the work that they do at Mettle Health. Thank you guys so much for being with us. I'm hoping Chris and Heather, you can introduce yourselves to start off.
Yeah.
Well, we
Thanks.
didn't decide who's going first. Heather, do you want to go first?
Sure. Thanks, Sonia. Thank you, Chris. I'm glad to have a chance to spend a bit of time with you all today. Yeah, I'm Heather Isaacs. I have been working as a chaplain for, I just had my 17th anniversary actually a few days ago.
Wow.
And most of that I spent in hospice and palliative care. More recently, I've moved into a hospital setting, working with both adult and pediatric patients and their loved ones. I am originally from the Central Valley of California and have been kind of making a life somewhere between the Bay Area and there for the last bit of time. So yeah, just loving the chance to maybe talk more about what spiritual care and chaplaincy has meant to me and what I hope to be able to offer to our mental health community as well.
Thanks, Heather, and congrats on your work anniversary.
Thanks.
Hi, everybody. Hi, Sonia. Hi, Heather. It's nice to be here with you. I'm Chris Adrian. I work primarily as a pediatric palliative care provider. But I also I trained as a chaplain, not to the same level that Heather has to certification, but I trained enough to get sponsored as a humanist chaplain. And even though I don't work just discreetly outside of Mettle, discreetly as a chaplain in the hospital setting, but everything the chaplains taught me, everything I learned on when I was being formed as a spiritual care provider, I use absolutely every day in my work in the hospital and inside of the hospital. I live in a beach town in California called Ventura, and I work in Los Angeles. And I've been out here, gosh, almost 5 years now. And I came from New York.
Great. Well, thank you both so much for being here. And Chris, I hope you'll talk a little bit more about how I love the combination of your disciplinary work. It seems really, really interesting and different. So one of the first questions to start us off that I hope you will both address is, what do you feel is a common misunderstanding of the role of the chaplain in caring for patients and families?
Maybe we
You go
can
first this time. Yeah, we'll just kind of go back and forth. How about that?
Yeah,
Okay.
I love that idea, because I suspect we'll probably answer from the same. We'll make a similar gesture in answering at first, which is that it's not just chaplains don't just pray with clients and patients, and some chaplains don't pray at all necessarily, and that spiritual care isn't always about, doesn't have to be about religion or religiosity, or even conventional notions of faith. And the people who taught me that were that was what I learned the first time. The chaplains kind of had me alone in the room, or had me outside of the traditional medical training setting. And I think that runs so deep, that I think kind of the first, like like everything I learned in clinical pastor education and chaplain school, it took a little while for it to sink in with me, because I'm not the quickest study in the world. But one thing, but the way that did sink in really emphatically for me was understanding, it's not just that the care a chaplain gives you and religiosity, or so it's not just that they're separated. It's just chaplains absolutely interface chaplains in a hospital setting absolutely do not proselytize or preach at you. It's not about bringing their spirituality to you in a way that's going to convert you. It's actually the fundamental opposite of that. And like the quickest way to get fired as a chaplain, or to wash out of chaplain training, is to proselytize. And maybe the other thing I can say is, if you're worried about, if you're interested in spiritual care, but I'm only worried, like, I don't want anyone coming to preach at me or proselytize to me, then you're in much greater danger of that from a physician, say, or a nurse, probably more the physicians, than somebody. You're 1,000 times more likely to experience that from a healthcare provider who's not a chaplain. Anyway, maybe I'll stop there and see, Heather, how that sounds to you.
Yeah, no, I agree entirely, Chris, with just the misunderstanding of what chaplains do. And I also hold that in context around the history of chaplaincy, that, chaplaincy hasn't always been this incredibly inclusive and kind of multidisciplinary kind of approach to care. And so part of what I really love about chaplaincy is the way it's also evolving to be more representative of the people that we are helping to care for, right, within our own communities. And so I'm seeing a real diversification. Over time, it's still perhaps not enough, but moving away from a religious view of spiritual care, and also incorporating that religion is a huge part of so many people's lives, and that as chaplains, we can actually come alongside in your faith journey, regardless of what ours is, to help you explore questions of connection and meaning, belonging within community where there might be spiritual injury. And then also from a place of, whether or not a person has any specific faith, or even whether they perceive of themselves as being like spiritual. I think there are sort of those matters of like ultimate concern that we share in a lot of ways. We express them differently. We have incredibly different answers. But to be human, I think often comes with questions about who am I? What is true for me? How do I connect to what matters most, the people that matter most? How do I repair relationships? How do I live with regret? How do I forgive myself? Facing mortality, what really is this mystery of life? What happens when we die? Like, we don't have to have answers for any of them, but I think it feels really familiar that we might have those questions. And chaplains are, I think, positioned kind of uniquely to be able to journey around some of those questions. And I always want people to feel safe, that when they reach out, and I know it's not always people's experiences, and there is still a lot of work that is being done to, I think, bring that view of chaplaincy into that truly kind of inclusive and multidisciplinary, transdisciplinary kind of understanding. I always want people to feel safe that when they are with me, with Chris, any chaplain, that we are genuinely there to support them on their terms, like through their lens of life. And that's really important to me, to be able to communicate, to help, I think, clarify some of the misconceptions, and also some of the past, perhaps, injuries that have happened around the use of chaplains in certain institutions. I hope that maybe answers some of that for the moment.
Yeah, absolutely. And
Heather, you're reminding me of this, and there's just another facet of what you're describing. But one of the most remarkable things about chaplaincy, for me, when I think about it, not just as a provider, but as somebody who might like one day be on the receiving end of spiritual care, which once upon a time I really thought I was allergic to, is that when a chaplain's coming to support you in that, they're not coming with they're not coming with answers to any of those questions that you posed. They're just coming to be with you as you entertain them, and the the professional aspect of chaplaincy, the thing that astonishes me so much, and that I admire so much, is that the training is all around coming to ask questions or be curious or just to support you in finding your own answers. And sometimes pretty often actually that means connecting you back to your own faith tradition, to look for those if you have one, but sometimes it doesn't. But that idea that it's all about that there's a professional somewhere in the hospital or in a care system, because not always chaplains aren't just in hospitals, that there's somebody there whose training is all about coming to help you be not alone in this place that you're in. And I think it's amazing. And the other thing, I guess the other thing I wish I knew is that there are people like the hospital makes provisions for this, but the hospital isn't very good about letting you know about it or letting you know what chaplains do. In some ways, it's the other, maybe another way to think. The other way I think about this is what I wish people knew. Like I wish the hospital knew in some ways, like how valuable a resource they have. Because I don't, even though I think it's a rare hospital for sure in my world, a rare pediatric hospital, they won't make room for spiritual care. They don't always know what the hospital itself doesn't always know what spiritual care is. And so the usual hospital mechanisms can't make the referral in quite the same way that it'd be like, oh, your bone is broken, I better get you an orthopedist.
That's such a good point. And just listening to you, Chris, that concept of someone to be with you, not necessarily to fix it in the way that medicine is how we usually think about it, to fix it, to cure it, to find a prescription for it. And that kind of leads into, you mentioned that hospitals a lot of the time don't know when to refer to you. They don't understand what is in, part of spiritual care. So what are the things that chaplains offer that, the hospital should understand and that other people should understand, and maybe just don't think about?
Can I let you start that one?
Yeah, I think in some ways it really depends on, the hospital that you are at and maybe where you live, and there's so many factors that might be a part of I'm working in 2 different regions of California right now, very different expectations and understandings about what chaplains do and give. And part of my work as a chaplain is to, I think, move in all those spaces and to really try to understand what is the need and how can I show up for this moment without kind of, judgment about how things should be for anybody. But just knowing that that's actually, an integrated part of your care. You can ask for that you have, if you have your own faith leaders or spiritual, kind of guides, that you can access that support while you're in the hospital. That chaplains can be a wonderful facilitator for that, to communicate if you have ritual needs, if you have sacramental support needs. There's somebody there who can be a support to you in that. And then also, like, in what I'm doing right now, I get called when I'm on call into all different kinds of situations. And I really appreciate that I am working in systems where those things are like, this is a chaplain moment, like, let's call the chaplain. There's like kind of these like trigger words and moments that really kind of elicit that. So I think just knowing that you have that there may be a degree of difference in what you might understand, like whether you have volunteer chaplains or professional chaplains or in the community, it may be different for where you're at, but that your spiritual life, your inner life absolutely matters in the hospital context, and that there are supports there that you can access.
You think maybe the only thing I can add is it's just gonna I think it's just gonna reiterate what you said, Heather. But that if when I think about what a what a chaplain can bring just to anybody at all in the hospital or in a care setting is, I just don't want, I feel very alone, and I need someone to come and be with me and help me with my feeling of loneliness, and you can always, and that's always like that. When I did work as a chaplain, and then we would be going through the little, there was a little referral book that the administrators or whoever was manning the phone would write down like reason for consultants, and as it was just feeling lonely and don't want to be alone. And that can be anything from they just come and sit with you to actually like working on the source of like going deeper in all the ways Heather you described. There's going to disclose that there's a 6-month-old Labrador puppy under my desk. About chaplaincy, and may be expressing them, but that like in a fundamental way, that's one thing that a chaplain can bring, and then all the sort of dozens and dozens of different flavors of coming to be with somebody and being present with them. The other thing, there's a lot that a chaplain does that was that as a palliative provider that I recognize as, oh, this is part of interdisciplinary palliative care. This is a piece of, there's a piece of this that any is to my mind like a just that has a lot of overlap with really high quality palliative care, and chaplains I think can come in. They can just come in. Again, depends. It's very different depending on what kind of hospital you're in or what kind of care setting you're in. But chaplains can slow things down. I think at least in one-on-one, they can come and help you be an experience, even though they may, like a palliative provider, they may not have answers about the medical stuff, but they can they can kind of slow down, be with you in the moment, ask you questions to try and but be a kind of companion in asking questions or clarifying questions, be a sounding board, and help people prepare for conversations with their care team. The other thing I think that the chaplains are all really, again, if the board certified chaplains who have been through the CPE process and gone all the way, they're quite expert at helping people understand what's important to them. And again, and there is a technique and an expertise to that, and so around decision making, even though that's something that people think about as the purview of a palliative care team helping with medical decision making. I think the way that a chaplain can come at it, not necessarily from the technical medical side, or even from different members of the palliative care team, whether it's a social worker or a psychologist, coming at it from a kind of a therapy oriented side, but coming at it just from a what's fundamentally important to you, what are your values as they pertain to something that goes beyond that kind of goes outside of yourself, or touches on something that's bigger than you. A chaplain can be that person and be that sounding board that may be a resource outside of somebody's immediate partner or their families. A sense of somebody who can help be objective in or stand outside of things, or be dispassionate in a way about being part of a decision-making process, while being really fundamentally committed to you and being trained to not bring their stuff into the decision-making, but really only to help you find yours, or help you enhance or discern your values. Like it's a terrible analogy, but like the monosodium glutamate of personal discernment. They just enhance what's there. They don't bring their own flavor.
That's actually a really interesting point, Chris. I'm wondering if you or Heather can just kind of expand on that idea a little bit of not bringing your stuff into the room. Like, why is that important?
Yeah, I think I think that's such a ethic of chaplaincy that I just ascribe to. It's really important to me, that I think my own formation over the years, like who I've become in this work, has been changed, and how I've understood that has changed over time. Working with different patients and clients over the years, I think one of the things I've noticed in myself, maybe in the last 10 to 15 years, is a deeper trust in each person's experience of life, that whatever my own experience and view, I can trust that there is something within each of us that is reaching for wholeness, healing, understanding, insight, meaning making. I don't have to, if I felt like I had that responsibility, I wouldn't be able to join in this, because it's more than anyone should feel like that's theirs to do. And in that, I've really come to trust, like even I was thinking about this the other night. I had one of those nights where my pager was just going off. It felt like every 10 minutes. And I had a number of visits that shift where I was walking into some really sorrowful, heartbreaking situations, and grief and fear and confusion, and they were asking for some kind of support that night. Some of it was explicit, like asking for a chaplain for something like prayer. Some of it was like what Chris was saying, like, I'm alone and I'm having to go through this, or it's too much for me, like this is more than what I can bear, I need somebody to talk to. And I had this moment like that night of just being really moved yet again by how different we all are. Like, we're all so different, and yet we are so incredibly vulnerable and human and mortal. And when these things happen, finding the space to hear ourselves, to tap into what might be like an inner compass or an inner awareness of yourself beyond the dizzying chaos of your life. I feel like chaplains help to kind of hold space, or become kind of like these. And I think actually the original word for chaplain comes from this, I think, Latin word for cloak, that little cloak. And so I feel like there's this way in which chaplains kind of come and say, we're going to hold this space and kind of maybe cloak you with a bit of quiet, support, compassion, whatever you need to be able to touch into your own truth. And on our end, for me, my stuff, like my beliefs, my values, my experiences, my identities, all matter to me so much. And yet, I think in right relationship to this work, they become what helps me to ground, what helps me to stay present when there are no answers. Like, what helps me to say, like, okay, this is where I am going to ground into a sense of being with this. So it's definitely not a perfect science, right? Like, there's all these ways in which I'm learning that I have not yet learned to see a person or their experience, or I'm coming with my own lens or my own baggage, that's also part of it, right? So we have to keep ourselves accountable in that way, and be truthful about where we need support. But we do our best, I think, to not put that on any other person in our care.
Yeah, again, I think I'm also be paraphrasing Heather, but you're reminding me, and Sonia, your question reminds me about one of, again, going back to a CPE lecture, where the instructor started out by just drawing a little, like what looked like an inverted, like a big a big U on the board. And then she sort of gave us her, she was like she was semi joking, but not really joking, saying, okay, I'm gonna sum up all of chaplaincy for you in this one illustration. And then she drew like a little stick figure down at the bottom of what this U turned out to be a hole. And she was like, well, here's somebody down in their hole, and your job as a chaplain is to do this. And then she drew more stick figures. The chaplain stick figure came along and had a ladder that they put down into the hole. They climb down into the hole, and they're like, you as the chaplain, you climb down, you use your ladder, you get down into this hole, you stay present with this person in an authentic, connected way, and then you climb out. But you can't, they can't use your ladder. The ladder only works for you. But the mere fact that you have a ladder, that somebody has a ladder, that where they can come down and be in this experience with them, and then but not be stuck there, is that was the essence of chaplaincy. And she was also like, well, guess what? This looks real simple, but it's not that simple. To make it takes a whole lot, in some ways, a whole lifetime to make your ladder, and then your ladder is always going to be falling apart, and just one way or another, you're going to think something, you're going to enter a hole that's so deep, you'd be like, I think I need more than one ladder. I need a fire truck. How do I make a fire truck? But anyway, that's I think to go back to your question, why is this important, Sonia? Why is it so important for the work? I think it's important for practitioners to I think again, something I wish people knew about chaplaincy and CPE is I feel like chaplains, and then also other psychosocial providers come at this in a similar way that's very different from how doctors and nurses are trained. But they're trained to know the difference between their stuff and somebody else's stuff, so they don't experience other people's suffering as their own, because nobody can do that forever. That's you burn out if you can't make a distinction between a parent's grief over the fact that they're going to lose their child. If you felt everything as intensely as a parent, you wouldn't last very long. But also, if you can't feel it in a way that is really connected, that parent isn't going to necessarily experience you as a real support or a different kind of support. So that balance between being authentically, but being feeling enough and being connected enough, being kind of viscerally engaged in your own compassion for somebody, like really mean it, like having some substance to the cloak you're putting over them. That the balance between that and giving them all your clothes, it both makes it sustainable, which is important. But I think there's a flip side to that, where it also makes it authentic in a way that somebody coming in and just being very which again, I think this is some clinicians in different care settings, like that was their, like in the emotional support for their patients means kind of being, I'm going to vanish into my own emotions, or like bring my emotionality to them in a way that's at a fever pitch, and there's something attractive about that, but also also not sustainable. And I think that I'm getting the puppy disagrees. He's trying to pull me out of the chair, but I think that there's also that it's more helpful for a client or a patient to meet someone who's like, oh, who are you? You really care about me. Maybe you even love me in ways that I never expected some professional in the hospital to be loving towards me, and yet you don't. And yet you're not. There's a equilibrium to you're standing someplace. Maybe it might not be totally steady, but you're standing someplace where you can stay and talk to me and not be and not be stuck here. You're coming to visit me here, but you're not going to be stuck here with me anyway. I think the puppy's letting me know I talked past my point.
Thank you for that example, Chris, of kind of the ladder in the hole. I think it's really helpful to have those kind of visuals around this. It's really helpful to think about what it is you guys do. And I'm wondering, to continue that, are there examples or experiences that have had a really big impact on both of you in your work as a chaplain that you could share?
Yeah, maybe there's one that comes immediately to mind. I think is, and I think of it as the first time I really had I felt like I understood finally what it meant to be in the what the idea of sacredness in a clinical setting, what that looked like in practice. And it wasn't the first time I'd met it, but it was the first time I recognized it. Maybe I could say that. That as a chaplain intern, I was on call one night and got called to the labor and delivery floor of the hospital I was working in, because there'd been a stillbirth and the parents were asking for support. And when I got there, they asked for they didn't entirely know what they wanted. They just wanted somebody to be with them and be like, to be present as part of the experience. But then once the chaplain showed up, they started asking. They didn't know I was just the intern. They didn't know I'd never been in a room like this in this way before. I'd been in, from the as a med student, as a resident, I'd been in those rooms before. But their question was kind of, as they asked questions, and I, drew after a little bit of training that I had, which was in a beautiful way, was the training of my peers, because I wasn't the first intern to be called to this place. And the way that CPE is set up, once or twice a week, you're sharing your experience with each other, getting feedback and help from your peers, and then your peers are doing things like, well, if you're ever in this situation, try this. So the answers that came about as they were asking things like, well, what does this mean? What do we do next? The two things that I had been if I were ever in this situation, I were told to make sure to do was you must tell them that they're parents. That they are parents now, and they will always be parents to this child, and then you must offer them some way to mark the occasion and recognize the sacredness of what just happened. I didn't know what sacredness was. I had my own ideas about from my altar boy days, but I didn't really want anything to do with that kind of sacredness anymore. And I probably had some kind of, some worry or fear about it, which is probably why I kept missing the sacred in my clinical interactions up until this point. But what what we ended up doing was a baptism, not a Catholic baptism, not even necessarily a religious baptism. It was a baptism, just some way to mark and name this child as the child of these two parents, and reinforce that all important, which it was told over and over, unless they don't want to be the parents of the child, you must help them. You must mark this. You must serve them somehow in that capacity. And that's, and I will never forget that. And that the other thing that I think that stuck with me around that was, this too is this is clinical work as much as any surgery, as much as any any medication plan, as much as any therapeutic encounter or breakthrough. That in that moment I was a fledgling chaplain clinician, and I had a exponentially expanding experience of having a window open on, this is what chaplains do. They hang out, they work. They're also they are fully comfortable, or they regardless of how totally comfortable they are, they can manage in and around the sacred, and be guides to people and companions to them when it shows up, when the sacred intrudes on their experience, which it does which it does a lot in the hospital. Not always, not always in around to death and dying. I think the sacred intrudes with joy and fireworks and spirited puppies. But anyway, and I'll step there and say, so that's one. But then there's something else that I think there's another thing that sort of happens all the time. It wasn't so much a hallelujah moment, but more of just like over and over again moments where I had the sense as a clinician, as a visitor in the room, that I was able to be a conduit somehow, or a connection to someone outside of them, to something that was larger than themselves, still part of themselves often, or maybe often that was how people thought of it. It wasn't necessarily that, oh, you're connecting them to something super, like, not in my case something supernatural, but just something that's a little bigger than how they are identifying in the moment. And that just in the course of a conversation, somebody, you could be the occasion for somebody to discover their own strength, the way they were resourced in a challenging setting.
Heather, how about you?
Oh, just kind of letting in what Chris has shared too. The way these stories change us, stay with us. I'm thinking there's one, I'll tell one's a little bit longer, and then one that kind of travels alongside it in my mind. And it kind of maybe for me illustrates what that experience of going into that hole might be like. But I remember once when I was working in a hospice, getting a call almost at the end of the day. So we were kind of, I was getting ready to leave, got a call that one of our new patients was having what we describe as like terminal agitation, was really in a very agitated place, had been in a confused way, altered state, being self-destructive, harming in his own home. And they were going to, they've been working to try to help manage his symptoms for some time, and we're planning to begin phenobarbital as a way to sedate some of the intensity of his symptoms. And they also thought, though, there's something here that feels like emotional, spiritual in nature. Let's call the chaplain out and see if there's any support that we can offer. So glad that they thought to do that. That's very also a hospice palliative care kind of thing, like that, working together in an interdisciplinary way. I got out there, and the patient was in a very altered state and had gone to the bathroom. And I remember, this is kind of a strange story to tell, but it stays with me. He went to the bathroom and he closed the door, but just by a little bit, like it was a little bit open, and he went and sat inside. And then I saw him through the crack in the door, like take a brush and turn the light off. And I was like, I have no idea what's happening here. I've never met this person. I don't know anything about like the context of what I'm witnessing. I know that I just asked the nurse for a little bit of time before she administered the phenobarbital, so I could see if there was any way that I could support him. And the nurse was looking at me like, are you serious right now that you think you can help this person when we're going to phenobarbital to do it? And I didn't know if I could help. But sometimes in those really boundary places, those liminal places in our consciousness, it's like maybe working with more like almost like a dreamscape sometimes. And I went and I actually crouched down by the door, like this little crack. And I introduced myself. This is how we're meeting for the first time. And I told him who I was. And he had military experience, and he actually knew that he had met chaplains in the military. And he said, I've been expecting you. And I was like, oh, okay, let's go. Like I said, can you tell me what's happening? And he said, I'm dying. I said, yes. And, I'm here, and we're all here to support you and hopefully to make this a little bit easier on you and your family. And it turned out that he was most scared about dying because his wife had early stage dementia. And they'd been married for like over 50 years, and he was leaving her. And he was really scared to leave her and how she would manage without him. And holding that with him, and I said something to the effect of like, there are times in life where we get pushed to the edge. Like if circumstances will happen, we get pushed to the edge and we can't do anything except trust, like trust in something. And I said, do you trust that your love for her will remain even after you're gone? And he said, I do trust that. And he said, now I can go with them. And he said there were people with him that he didn't know that were all standing in the room. He said, now I can go with them. And my wife's mother is here too, and she's going to look after her. And then he went and he laid down in the bed. He didn't die that night, but they didn't have to medicate him. And he continued to live for a while, after a couple weeks longer. And it was still like this, there was still these moments of like, and his family was able to kind of connect the dots and understand more about the reassurance that he needed and where they could support him. And I felt like he was able to work through that. And at one point he said to me, why do you understand me when nobody else does? And that felt like really like one of those moments where I don't exactly understand all that happened. There are mysteries in this that I don't pretend to try to answer. And I also have lived with the opposite, where I've felt like I brought everything in my toolbox into a situation very similar. And it was nothing that I could do to help. Like it felt like I was hitting a wall. Like I wasn't the person that could help. And it was like somebody that I'd been working with every week for like 8 months. And when they died and they began to have terminal agitation, it felt untouchable. So I have learned like to hold space for like that where at times you get to be present for these transformative healing breakthroughs. Something in your chaplain toolbox was just what was needed in that moment. Other times you're sitting with just this unanswerable human suffering, and all you can do is be present and say, I'm here, and I am not going to abandon you in this. I am here. I'm going to connect you however I can to whatever support is here, so you don't have to go through it alone, even if you feel alone. So for me as a chaplain, I feel like there's been so much humbling around where there are times when I'm in the hole with people and I'm like, I have a flashlight and like, hey, look, there's some ways up. You can find this hand. Oh, what's working? And I can almost be like in this collaborative relationship where they can kind of find their own way out of the hole. Then other times, like, it doesn't matter how bright my light might be. It's like, they can't see it. And so whether it's my own lack of skills, what's required, I think it's also just the nature of like the mystery of being human and how we heal and how we open. And I mean, I've been in therapy myself for like a way long time. Like, so obviously like if healing were easy, I wouldn't have to invest so much energy in it. But for me as a chaplain, it feels like the showing up, the trusting in the mystery of this life, the belief that each person has within them resources, a connection to life in some way that I can honor and mirror and maybe support, gives me, I think, the ability to stay in it, I guess, to not have the answers, and sometimes behold like these amazing things, and also behold the kind of profound suffering that has no name. I feel like I've talked too much, but it's like it's a hard thing to hold all of that, and those things change me and sometimes lay me flat for a bit. And I also don't know how I would not do this work sometimes. It just feels like it's so so much a part of my own like spiritual life and spiritual practice. So.
That's beautiful, Heather. Thank you so much. I know we're kind of coming up here on the time that we have together. So if either of you have any other thoughts around what type, if someone is in need of help, like when should they consider checking in with a chaplain? What kind of people do you end up speaking with that you think could benefit from those conversations?
I think everybody. I mean, I'm a little bit like, I don't know, everything. I think everybody should talk to a chaplain.
Well, as you guys are talking, I'm thinking to myself, I need a chaplain. So yes, that sounds right.
I think everybody should try one out. And the other, maybe the only thing I'll say is maybe one of the things that I think is so many of the many things I think is wonderful, are wonderful about Mettle is that there's a little bit, I think there's a little bit of chaplain in every Mettle provider, meaning that because I think every Mettle provider, I think that's, it's sort of the way we're built around this, what feels like an idea of, oh, like here's someone who can will come from all kinds of disciplines, but we can really just be present for you and be with you in whatever you're dealing with, and also but not just sit there and watch or just listen, but really try to be helpful in whatever way we can, and that looks a little bit different for everybody. But I think every Mettle provider I've met has that sense of authenticity, and really coming out of I guess we all come in one way or another out of palliative care, and I think that there's an element of a common element of being good spiritual care providers, absolutely everybody. And then but the other thing I could say is, if you but not everybody is. But you may need, maybe you need a chaplain who's you'd be like a chaplain, you need a Ghostbuster. And you might, and not every, I would say not every Mettle provider might be a good Ghostbuster for you, or it might be, I don't know if people remember Tangina from Poltergeist. Not everybody, maybe I'll phrase it another way and then shut up. Not everybody might be able to, some providers might be, or some chaplains might, but you might need somebody who's like, I've been in that space that Heather's someone who's been in that space that Heather just described, and been in a lot. And if you need someone who's fluent by experience in those circles, then maybe someone who's fully trained as a chaplain, not just a crackerjack spiritual care provider, is someone to think of.
Great, thank you. Any extra thoughts from you, Heather, before we say goodbye?
No, I hope everything that maybe Chris and I have shared just sort of opens up that invitation that, we are here and that we are, able and willing to accompany you on your terms. And that's really, I think, a perspective of mental health that is very, congruent with what we are offering. And there are sort of also special skill sets and ways of understanding that we bring to that conversation. So.
Yeah, wonderful. Oh, thank you guys so much for spending some time with us and just talking about what it is you do. I loved hearing all of it. Thank you again, and hopefully we can do this again and just talk more about the work that you do and what you bring to clients and patients. Thank you both so much.
Thank you. Thank you, Chris. Thank you, Sonia.
Thanks, Heather. Thanks,
Bye,
Sonia.
guys.